Welcome to this training on implementing your guide to postpartum and newborn care. This video will help you standardize patient education, making it easier for your staff to educate and for patients to learn. Providing consistent education to patients is a major challenge. Nurses juggle many responsibilities, such as charting, patient care, and managing visitors, while patients need reliable information to feel prepared. Finding the time to deliver that education consistently can be difficult. This creates a high demand for clear and efficient education. Patients need reliable information to feel prepared for discharge, but nurses often struggle to find the time for consistent education. The Your Guide to Postpartum and Newborn Care includes language and resources aligned with the Hospital Experience Survey. Highlighting videos and content with this aligned language can improve patient satisfaction scores and ensure patients feel well-informed. Your Guide to Postpartum and Newborn Care is available in both print and digital formats, making it accessible and convenient for patients and staff. It is organized in sections that focus on postpartum recovery, newborn care, and breastfeeding, with helpful tools to simplify education for everyone involved. It features a clear table of contents, a glossary, A1's post-birth warning signs, and a feeding and diaper tracking log. The book's design addresses different learning styles. High-quality photos and custom illustrations make complex topics easy to understand. Call-out boxes highlight crucial information, and QR codes provide instant access to helpful videos. It is accompanied by two tools, the Badge Buddy and Discharge Checklist, each helping to keep both staff and patients on track during the education process. The Badge Buddy is a quick reference tool that allows staff to easily locate specific content within the book to address patient questions or provide guidance. The one-page Discharge Checklist guides patients and staff through the discharge process, ensuring key topics are covered, and supports patient satisfaction by addressing key survey questions, such as: did doctors, nurses, or other hospital staff work with you and your family or caregiver in making plans for your care after you left the hospital? During this hospital stay, did doctors, nurses, or other hospital staff talk with you about whether you would have the help you needed after you left the hospital? Make sure to follow up with patients on these points to ensure they feel confident and supported as they transition home. When you first give a patient the book, take a moment to walk them through it. Show them how to find topics in the table of contents and glossary, and demonstrate how to scan QR codes for videos. Offer help with their phones if needed. Point out specific sections aligned with their immediate needs. For visual learners, use the photos and illustrations to clarify your points. You can also integrate videos into your bedside teaching. Discuss any questions afterward, and encourage them to continue using the book at home. Initial the checklist or book to track progress. Patients can feel overwhelmed by new information during a short hospital stay. Reassure them they will take the book home to reference anytime. This reminder not only solidifies their understanding, but also aligns with key satisfaction survey questions, ensuring they feel well-informed after discharge. The best time to begin patient education is as early as possible, ideally during admission in triage or labor and delivery. This gives patients more time to absorb information and ask questions. Introduce topics like skin-to-skin contact, breastfeeding, and rooming in early on. Use routine tasks like taking vital signs to reinforce key points. For example, you can explain the signs of postpartum preeclampsia while checking blood pressure. Starting early ensures patients are better prepared, reducing overwhelm before discharge. Patients benefit greatly when partners and family are involved. Invite them to join discussions about vital topics like A1's post-birth warning signs or newborn care. By including them, you create a home team that supports the patient after discharge. This also supports satisfaction survey questions, ensuring families feel informed and confident. Involving family and caregivers is key to a smooth transition, boosting adherence, and addressing survey questions like, did hospital staff give your family enough information about symptoms or health problems to watch for after discharge? Education doesn't need to be delivered all at once. Use your rounding time to break it down into manageable pieces, incorporating patient education into your routine 5 Ps of rounding. By By incorporating education into your routine rounds, you can reinforce important topics, address any concerns, and ensure patients have the opportunity to ask questions in real time. Nurse leaders play a vital role. During rounds, review the discharge sheet or book to check patient understanding and acknowledge staff education efforts. For example, you might say, "I see that Jen has gone over feeding cues with you. Do you have any questions about them while I'm here? I'm happy to help." This reinforces learning, encourages engagement, and recognizes your team's dedication to quality education. To ensure consistent education, train all staff on how to use the tools. Use this video as an introduction, then follow up with competency checklists, read and sign forms, or quizzes. Incorporate the guide into annual training, orientation, and residency programs. Nursing students and clinical instructors can also use it, ensuring consistency across all care providers. By implementing your guide to postpartum and newborn care, you'll provide patients with the consistent, high-quality education they need to feel confident and prepared. These resources simplify the education process, improve patient outcomes, and enhance satisfaction for both patients and their families.